Well, in my commitment to the bit today, I come to you afflicted by what I hope is the common cold, to ask a clarifying question. What in the ever-living is happening at the CDC and the Federal Department of Health and Human Services?
Children who are circumcised early have double the rate of autism.
From Battleborn Progress, this is Battleborn Bites. My name is Jacob. Let's go get our booster shots. So I actually do have a cold, that is not a joke, so let's see how quickly I can power through this before the cold medicine takes me out. But if you've been paying passive attention to the news, you may have seen some interesting headlines about public health recently. Stuff like inconclusive research to say Tylenol and/or circumcision is causing autism, sweeping changes to vaccination guidelines, and the total gutting of the Centers for Disease Control and Prevention. It's a lot to take in all at once. So here's a separate question. How do we even get here? Why should we care about the FDA or the CDC or the DHHS? Well, it's easy to take for granted now the fact that we have stuff like germ theory or advanced pharmacology. But before the late 1800s, yes, I'm going that far back, I cannot stress this enough, medicine was extremely vibes-based. You might know about the medieval humors, the idea that you had 4 liquids determining your health: blood, phlegm, yellow bile, and black bile. And let me tell you, right now, I am all phlegm. Oh God. But when we talk about public health, a lot of things start happening at the same time in the mid to late 1800s. For one, the aforementioned germ theory, which gives us the development of the first vaccines, especially for smallpox, and later the invention of the first antibiotics and the creation of stuff like pasteurization, the use of which on milk had an almost immediate effect on infant mortality rates. But there's also a big movement to increase food safety. As the Industrial Revolution accelerated in Victorian Britain and later in the US, food became increasingly mass-produced. With mass production came some shortcuts, like when millers and bakers would cut flour with alum, bone, or chalk in order to stretch bread supplies. And boy howdy, you do not want to know what was in the sausage. With that backdrop, the US passed the Pure Food and Drugs Act of 1906, the culmination of 25 years of piecemeal legislation to that point that had attempted to regulate, well, food and drugs. But it's not until the 1930s that laws for this stuff are given any teeth. Well, in trying to pitch legislators on the need for stricter laws, the FDA at the time listed a whole bunch of stuff that was both 1, extremely bad, and 2, still legal under the 1906 law. That includes an eyelash dye that could cause permanent blindness, and something called Radithor, a health tonic whose main ingredient was literally radium, which it should go without saying can and did give people radiation poisoning, which kills you. They were built different in the 20s, I guess. But as is often the case, it took mass tragedy before Congress actually acted. In 1937, more than 100 people, many of whom were children, were killed when a Tennessee drug company mixed a common powder drug for strep throat into a new liquid form with a chemical called ethylene glycol, without testing for toxicity levels. You may know that chemical by its far more common derivative, antifreeze. After this, called the sulfonamide disaster, the FDA is for the first time given the ability to require the testing of drugs before they could be approved by the Federal Food, Drug, and Cosmetic Act of 1938. That, it turned out, to be somewhat prescient, because in 1957, pregnant women across the world started being sold a drug called thalidomide, designed to help anxiety, trouble sleeping, and morning sickness. What followed has been described as the biggest man-made medical disaster in history, when more than 10,000 children were born with debilitating birth defects. But the FDA never approved thalidomide in the US, in large part because of one FDA medical officer who was unsatisfied with the safety data being presented by the manufacturer. Around the same time, the federal government similarly becomes more involved in the business of actually preventing disease. During World War II, the feds stand up something called the Office of Malaria Control in War Areas, which really rolls off the tongue, but they plop it in Atlanta, Georgia, and the agency eventually grows into the Centers for Disease Control and Prevention. And you know what? Take that little, that's your little trivia fact for today. That's why it's in Atlanta. You ever wondered why The Walking Dead is in Atlanta and they're heading to the CDC? How quaint that feels in the modern time. There you go. Well, over time, immunization rates increase and diseases start to disappear. The last case of smallpox in the US was reported in 1949. By 1979, the last case of wild polio virus was reported, and general vaccination rates would continue to peak into the early 1980s. But If we're talking about vaccines, we've got to talk MMR, the measles, mumps, and rubella vaccine. Measles is particularly problematic because it is among the most infectious diseases known to man. Per the National Foundation for Infectious Diseases, one measles case can potentially infect between 12 and 18 people. This is known as the R0 in techno jargon. And for comparison, flu's R0 is 2 to 3, and COVID's is somewhere between 1.5 and 3.5, if that tells you anything about measles. Nowhere in recent memory is this more clear than in the late 80s and early 1990s, when a measles epidemic infected more than 55,000 children, requiring 11,000 hospitalizations and causing 123 deaths. It happened in large part because vaccination rates had started falling precipitously because of Reagan-era budget cuts to health programs, with vaccination rates dropping especially fast among low-income Black and Hispanic children. In response, the Clinton administration undertook a massive public outreach campaign in the 1990s and pushed Congress to create something called the Vaccines for Children program, designed to widen the vaccination net for the same low-income households that were most susceptible to the last measles outbreak. And here, of course, are the seeds of everything we're dealing with now. Because the first modern anti-vax campaign starts on the back of a debunked and retracted medical study linking MMR vaccines to childhood autism in a sample of just 12 children, that's right, 12, in 1998. We have been paying for the sins of that debunked paper ever since. Here's a CDC map. Blue are states that have more than 95% of kindergartners vaccinated for MMR. Dark orange is less than 90%. Here's the map in 2009, and here's that same map in 2023. That does not seem great, but here, let's look at a chart of every reported measles case from 2000 to today. Very cool. With all that context out of the way, we return to your regularly scheduled programming about Health and Human Services Secretary and brainworm connoisseur Robert F. Kennedy Jr. I would be, unfortunately, here all day if I went into everything RFK Jr. has done this calendar year. But in short, he said measles vaccines were a personal choice and then hawked unproven treatments like cod liver oil. He fired every member of the CDC vaccine committee and then appointed 8 new members, including 3 anti-vaxxers, and then made it significantly harder to get a new COVID vaccine. In a normal world, the real pièce de résistance would be the sweeping and basically unfounded claim that Tylenol, the brand name for acetaminophen, causes autism. Well, we should be clearer than the president.
Nothing bad can happen. It can only good happen.
And say they found a correlational study that could link acetaminophen to autism in some pregnant mothers, but weren't able to replicate those findings in a sibling control study. Or that fevers during pregnancy are incredibly dangerous, and one of the only medications to safely treat those fevers is acetaminophen.
I said, well, let's see how we say that. Acetaminophen.
But wait, there's more. Last month, ousted CDC Director Susan Menares testified before Congress that she was fired because she refused to accept RFK Jr.'s vaccine recommendations and blanket firing of career scientists. Then, with the government shutdown as cover, the Trump White House fired over 1,300 staffers at the CDC in a Friday night massacre. But in a grim echo of the Doge chaos from earlier this year, the CDC reinstated more than half of those employees on Tuesday. Which, look, this is not to say that any agency's process is above reproach, including the FDA, the CDC, and the DHHS. As someone with a cold, I'm allowed to complain about this, but you'll notice this box of Dayquil says it's a nasal decongestant. That's because of the ingredient phenylephrine, approved by the FDA for that use in 1976. In 2006, it actually becomes the main ingredient in most over-the-counter decongestants because an older, more effective drug, pseudoephedrine, got moved behind the counter because it could be used to make meth. I'm sure there's a Breaking Bad joke in here somewhere. Well, in 2023, an FDA advisory committee unanimously concluded that oral phenylephrine, not the nasal stuff, the oral stuff, did no better job at clearing your sinuses than a placebo, a sugar pill. In 2024, the FDA actually proposed ending the use of phenylephrine as a decongestant altogether, though that hasn't been finalized, and to be clear, it's not because any of this is unsafe, it's just because it doesn't work. No regulatory agency is perfect, especially one like the FDA, where the outside pressures are both unique and extraordinarily intense. Not only is there a time pressure to make sure that patients have access to potentially life-saving drugs, but pharmaceutical companies have an incentive to start selling those drugs that cost them millions to develop as soon as possible. But the stakes are super high, especially when we're talking about public health, not just yours or mine, but every single one of us. And what we can know for sure is that decisions made by the federal government about this stuff can affect all of us. Think back to the measles epidemic of the late 80s and early 90s, a completely avoidable tragedy that could have been headed off by continuing to invest in early childhood vaccinations during the Reagan years. But now, what's old is new again. It is good to be skeptical of corporate influence on health and wellness, but today's vaccine skepticism has gone beyond that, ignoring scientific evidence or cherry-picking favorable data in order to get rid of access to vaccines that, to put it bluntly, can and will save lives. And none of this is theoretical. Early this year, RFK Jr. and the Trump administration vowed to find the cause of autism. They even gave themselves a deadline, which tells you everything you need to know. This is not science. This is starting with a conclusion and trying to find any justification that will make it stick. Which is why, by the way, they landed on Tylenol or acetaminophen, not the MMR vaccination. But even then, they're pushing for individual shots for MMR rather than a combination, increasing the amount of doctor's visits, needles in arms, and just as likely, decreasing vaccination rates even further. All this to say, I'm just glad this Dayquil has other stuff in it, like acetaminophen.
Acetaminophen. Is that okay?
But that does it for today's episode. If you like the show, be sure to like or subscribe to be sure you're the first to know when we upload a new episode. Until then, for Battleborn Progress, this has been Battleborn Bites. We'll see you next week.